Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about Sinus Tarsi Syndrome. First off, let me help you understand exactly where the sinus tarsi is. So if you take a model of the foot here and you actually look at it, you'll actually see you've got the ankle joint here, and you get the calcaneus, and you have what looks almost like, if we tilt it, like an eye in that area. And that is the sinus tarsi. That is a location between the talus and the calcaneus. So it sits right in between, right in there, in that area. That's the sinus tarsi, and it can be a pretty significant symptomatic problem. It usually causes significant pain. People will describe it as ankle pain, although it's actually a foot pain in the rear foot area instead. It was initially described in 1957 by Dennis O'Connor, when he was evaluating why an individual actually had significant discomfort in the back of their foot. There are two different types of presentations of sinus tarsi syndrome. One is from an injury. So if you have an ankle sprain, a lateral ankle sprain, or an inversion sprain where you roll the ankle, you can actually injure the sinus tarsi as well. And this injury, in about 70 to 80% of the individuals, will cause a sinus tarsi pain. 20 to 30% of the presentations of sinus tarsi will be from the opposite, where you pronate the foot too much, you're flattening out the foot, and you're actually impinging. You're pinching in that sinus tarsi, so you're pinching internally there. So you get pretty significant pain in the sinus tarsi area, typically on the lateral side of the foot, the outside of the foot. You can actually push right in that sinus tarsi and it will cause significant discomfort and pain. It can be evaluated by x-ray. It can be evaluated by bones scan, CT, and MRI. And sometimes on the MRIs, you'll actually even see injury to the ligaments in that area. So once it's diagnosed, once you determine that it's actually the sinus tarsi that's the problem, there are a couple of different ways you can treat it. It's basically an inflammation. It's a sprain of that area. And so decreasing the inflammation, like using anti-inflammatories, can actually help quite a bit. You can actually do cortisone shots to the joint itself, which will decrease the inflammation, decrease the pain, and help it. You can actually do periods of immobilization, maybe putting in a boot or a brace or something that limits the motion there. You can put in a stable shoe, a shoe that doesn't let you pronate or doesn't let you supinate, where you're rolling out, and stressing that can also be helpful. So a lot of that can help, and even simple over-the-counter orthotics can sometimes help, arch supports or inserts, though a custom orthotic will also help in this area. The point is that you want to decrease the inflammation, decrease the stress, and allow it to recover like any normal sprain. Something else that we have started using in our office for the sinus tarsi syndrome would be laser in that area. Same type of thing. Decreasing pain, decreasing swelling, and stimulating the area to heal so it can get better. And it usually gets better quicker, as with other sprains. You can reduce the time to 2 weeks instead of being in 4 to 6 weeks of recovery. So sinus tarsi syndrome can be a big deal. It can be pretty significant pain. It hurts when you walk. It hurts when you function. And it needs to be treated, but it can be treated without having to say, okay, I need to go do some major surgery or something like that. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 141, Sinus Tarsi Syndrome.